Dr. Cheryl Simmons Gray stands at the helm of the Patuxent River, Maryland chapter of the Lynx. As a dynamic, community-centered president, a pharmacist detrained, long-serving woman leader within the organization, she guides a chapter of accomplished women dedicated to service, scholarship, and the advancement of African American communities. Under her leadership, the chapter emphasizes collaboration, innovation, and meaningful impact, an approach reflected in recent chapter retreats and initiatives that highlight knowledge sharing, strategic planning, and strengthen sisterhood. The Patuxent River, Maryland chapter is part of an international network of more than 17,000 members across 300 chapters, all committed to enriching and sustaining the cultural and economic well-being of African American communities. Dr. Gray's leadership connects local service with this broader legacy of impact. I am your host of The Next Word, and welcome. And welcome to you, Cheryl.
Thank you so much.
Really, I really appreciate you being here. And I always ask my guests their history. Mm-hmm. So we talk a little bit about how you became a trained pharmacist, but even before that, where you came from.
So thank you for that question. I love to talk about my journey. It has been what I consider a very rewarding one. I was born in Chicago, and I came to this area to pursue a degree in pharmacy at Howard University. So I wanted to be in medicine, and I chose pharmacy. And so I received my undergraduate degree at Howard University. I continued on at the University of Maryland at Baltimore to get my doctorate of pharmacy degree.
That's great. Very near and dear to my heart. Mm-hmm. And now you're the president of the Lynx chapter for Patuxent, Maryland. And this training you had as a pharmacist, how has that actually helped shape what you're doing now for the Lynx?
Well, as pharmacists, we take an oath. And two of the very important tenets of our oath is commitment to service and being a lifelong service-orientated person. We take that commitment. Mm-hmm. We're supposed to serve our community and the population. So we take that very seriously. We take an oath to help with health disparities. That's part of the actual language in the oath. So it was easy for me to continue to do the service because, again, I took the oath that I took very seriously. And as a person, I consider it very important to give service.
So you mentioned health disparities. Mm-hmm. What do you see the most often in the community in terms of health disparities?
There's so many health disparities, unfortunately. Some of the main ones are diabetes, cancer, access to health care, medication affordability, so many disparities that we don't really think about, communication. And of course, with our economic troubles that we're having now, the affordability of good health care and the access with disparities in our community, even Montgomery County, which is a very wealthy community. However, there are great disparities with Blacks, with Asians, and Hispanics in Montgomery County.
Right. Oh, yeah. And, we look at obesity also, mm-hmm. which of course leads into diabetes. And are we seeing anything in terms of fall in rates in terms of obesity numbers, or just because there are a number of new drugs on the market that address weight loss?
There are, and a lot of people are taking advantage of the weight loss drugs, but they're very expensive.
Yes. Yep.
So for those communities that don't have the money, then they're not a part of that group of people getting the benefit. And so what happens is those numbers don't go down in those that have the most disparities.
Right. Even the compounds, even the new ones that are coming on the market, are also
very expensive.
Very expensive.
And unless you have good insurance or if you can afford the medications, it's hard to get them. And we're seeing that the populations that we're trying to reach out to and address, they can't afford those medications.
Right, yeah, no, right, absolutely. And I personally believe, of course, pharmacists play a key role in terms of community outreach.
Yes.
And you've been doing that for 40 plus years.
Yes, I have.
And so the role now that you've assumed as president of the Maryland Patuxent chapter has actually been quite fitting, because you're focused on community service.
So yes, a lot of the organizations that I belong to, they focus right in on service. I believe in service, as Shirley Chisholm and others have said, service is the rent we pay to live here. And I think it's so important that we give back and do the service to help our community.
But when you were going back to when you were going to school, there weren't many women pharmacists.
There weren't. Things have changed throughout the years, and now it probably is half women in the field. But when I first entered pharmacy school in the 70s, we were in the minority as far as the women.
And minority women were in the minority.
Yes, absolutely.
Right.
Women as a whole, and then certainly minorities were in the minority.
So today, in terms of the role you have today with Links, you're sponsoring so many summits: economic well-being, workforce training probably, but now, of course, you have a wellness and health summit.
Yes.
Coming up.
Yes, we have a Black Family Wellness Summit that we do every year. It's a yearly project that links nationally. We all participate in it. It's in March. And we're so proud of the outcomes that are coming out of this summit, this health fair expo. And again, all of our chapters participate in this expo, and we're trying to close the gap in the health disparities with our communities and the community abroad, because all are welcome to come. Right. I mean, it's entitled Black Family Wellness, but we welcome everyone.
Right. So it's really all family wellness.
It's all family, and it's the whole family.
Yeah, that's what, now there are a lot of misconceptions about, public health and medication use. Have you seen, you've encountered this, I'm sure, in your practice of 40 years.
Absolutely. I had a diabetes clinic that I was in charge of, and a lot of my patients couldn't afford the medications. So they would tell me it's either feed my children or buy the medication. I saw this for many, many years, patients that just couldn't afford the medications. Big problem. And it has only increased throughout the years. So we really have to work on, as a government, decreasing the cost of medications to help our people to afford what they need. And
also, of course, food and health practices.
Absolutely.
It's critical.
Yes.
Now, going back to the health summit that you're going to be sponsoring, you're cooperating with Montgomery College.
Yes. So this year we have a partnership with Montgomery College, the Rockville campus, where the president is Dr. Williams. And so we are so proud of this partnership. And Montgomery County College has a history of serving the community, and so we're expecting hundreds of people to come out to participate in this health fair. We're going to have dental care, audiology care. We're going to have cancer education. We're going to have a farmer teaching people how to grow their own food and eat healthy. We're going to have blood pressure screening. We're going to have so much offered, and again, it's for the entire family, and everything is free.
Going back to those interested on teaching people how to farm their own vegetables, this is something that I know the late Leon Sullivan out of Philadelphia, and of course the founder of OIC International, this was something that they promoted. And they would actually have gardens on top of rooftops in Philadelphia in order for people to farm and get fresh vegetables, which is critical. Have you experienced this? Have you seen this?
So we have a relationship with a farmer that supplies fresh vegetables to a lot of our members. We buy from him. And this will be his second year coming to our Black Family Wellness Expo. And he brings pots with dirt and the things that you can actually start the plants. He'll bring seedlings and it's wonderful, the education they give you, and you actually leave with something that you can go home. Last year I went home with a plant of lettuce and it grew and it was delicious.
Really?
So yes, I want to expand on that, and hopefully everyone else took advantage of it and started planting. You know, we can do it anywhere.
And in terms of just going beyond just the community, but also the youth, do you bring children into this? Are there?
Absolutely, and they love working with the farmer at the expo to put together the plants, and we need to start early on, teaching our children how important it is to eat fresh vegetables and fruit.
Oh, absolutely.
So this is a part of the education to help create lifelong good habits.
Do you think this program can be really broadened, county-wise, or? It's exciting. It's a great program.
Well, we're going to go to the demand of the population that comes out. But we do this, there are 22 chapters in the DMV area, and all of us are having these expos. Everywhere, yes. Everywhere in our area, they're doing the health expos.
On this, on a certain time in March?
Yes, in March. And we get to choose what date. A lot of them are doing it on the 21st of March. We're having ours on the 14th of March. But throughout the month of March, there are expos all around the DMV area.
And as far as I'm concerned, March is Women's History Month, as we both know.
Yes.
But every month is Women's History Month. And so I know you'll be doing other programs, and can we anticipate other health type programs throughout the year? Or?
Yes, we do a lot with healthcare. We have a committee, we call them FACET, that's entitled Health and Human Services, and they come up with great activities. Again, we have usually a symposium about cancer where we bring in experts, doctors that talk about it, which is a great program. We do it locally, and we also do it in the DMV area. It's called the Red Dress. It happens in February, and we get thousands of people who participate on that Friday via Zoom for the health fair. And the outcomes, people have come back year after year to say how it helped them, how they discovered things, and how they went and it motivated them to seek care, and it saved their lives. So yes, we're always doing healthcare programs as well as other educational programs.
That's terrific. We're going to take a short break because I want to come back and talk to you about you, and of course about links, and then we'll be back. You're watching The Next Word. We are going to take a short break, and we'll be right back.
I think I finally found.
Hey, how you doing?
Hey, Mason.
Hey, Mason.
Got a new house. It's looking pretty cool so far.
A place that I call home.
I'm teaching Louise how to cook some lasagna.
It only takes a spark to make a fire start.
Thank you.
Study, please.
I think I finally found a place to make my own. A place that I call home. This place that I call home.
Welcome back to The Next Word. I'm your host, Christine Warnke, and this episode features a community leader and health activist, Dr. Cheryl Simmons Gray. Dr. Simmons Gray is the president of the Patuxent Links chapter, an organization that has a tremendous impact on the health and welfare of the community here in Maryland's backyard. Links. So first, thank you again. But what made you join Links?
As I mentioned earlier, I really consider service as the rent we pay
Right.
to live on
It's
this
a great
earth.
word. Yeah.
And the Links is all about service. We have two tenets, friendship and service, and we take both of them equally. And so it's really wonderful to be friends with so many great women, great professional women in all fields, to get to meet these women, to be friends with them, and to serve together arm in arm. So it's very rewarding, and I really believe in the mission of the Links Incorporated.
Yep. And it started in 1946 in Philadelphia by two young women, really, right?
Yes.
And they came together and they
Yes.
thought they were stronger in numbers.
Yes, absolutely. Two friends coming together and expressing a need in the community for service as well as friendship. And so we're very pleased that our two founders had that vision and started the Links, like you said, in Philadelphia in 1946.
And they were involved also in the civil rights movement.
Absolutely. Their husbands worked in civil rights also, and they were an extension of supporting their husbands, and they felt the need for women to get involved. And as you know, women were involved in everything.
Right.
You know, we helped with the world wars. You know, we stood in the place of the gap.
Absolutely.
And so they felt the need, and they addressed that need.
Is that where the NAACP came from? I mean, did it sort of grow into the NAACP? Or that was there already in the
Yes, the NAACP had already been established.
Okay.
And a lot of them are members
Yeah.
of that organization, as well as a partnership with the Links. We partner with NAACP. We have a push right now where we're encouraging all members to be individual members also.
Right, that's great. But you also had, back in Philly, you had a great mentor in Dr. Leon Sullivan, who actually took his vision of organizing people around the world
Yes.
and providing help around the world with chapters all over the world, particularly in Africa. Right. And
Yeah.
so this brings me to my question. Beyond just the community of Maryland, you're now going beyond that to international and Ghana.
So yes, we are an international organization. So we do have chapters in the Bahamas, in Jamaica, in the United Kingdom. And so our reach, we want to reach worldwide. My chapter, we sponsor a group of young ladies that are students at a school in Ghana. And we're actually taking a trip there in April through May, the end of April through May, to visit our school, to visit our young girls. We call them gyms. We have local gyms, and we have gyms in Ghana. And we're excited about this trip. There are so many health disparities that we're talking about, but certainly in Africa also. And the disparities that they have a disparity of no clean water.
Right.
And so we're building a well. They call it a borehole, but we're doing that for the school, and we're excited about providing them their own source of water.
Oh, that's terrific.
So that's one of the things we're looking forward to, and spending time where we're going to have a curriculum where we go into the school and help to, again, fill some of the gaps that.
A big gap in the water, because women are responsible for getting the water in Africa, as they are in India and other,
Yes, and clean water, is really scarce.
And it doesn't really take that much
So
in
no,
terms of showing them how you get clean water, because there's so many new technologies and techniques that are available.
Yes, but you have to have the money
But
to
you have to
do
have the
these
money,
wells.
Right,
You
the
know,
wells are critical.
Yes,
Yeah.
and if you don't have the money, then it's extremely hard for them to do it. They've been relying on water from a community not very close. And sometimes they get water and sometimes they don't. So we want to give them their own water source.
That's terrific.
Because water is life. You can't live
That's right.
without water.
And the school here is, what's the name of it?
So we have a relationship with several schools, Germantown Elementary, Quinch Orchard Elementary. We have several schools that we pull young ladies from. And they come, we generally meet in Germantown Elementary School. We take them on trips. So we try to expose them to different things. We've gone to the museum, we've gone to the theater. We actually had a princess come over and teach etiquette to them, an African princess, Princess Esther. So we do try to be innovative with our programs. And again, expose them to things, because it's very important. If you don't have the exposure, then you don't have the motivation and the ideas of what you can do.
Absolutely. And you know, Ghana, because it's an English-speaking country,
Yes.
it's obviously more
Yes.
accessible and appealing in terms of having these partnerships,
Yes.
which are invaluable for young people.
And we have a member that started us there. She saw a need. She was there. She had a relationship with this school. And so she offered it up, and they were very excited. We were very excited to partner and extend our reach in our service.
So how many students are you taking on this trip?
So we're not taking students. We have students in the school there.
Oh, there. Right.
Yes, it'll be members that go on this trip. And
Your
we're-
members?
Yes,
Okay.
members of our chapter will be going there to facilitate the workshops and to do the ribbon cutting ceremony for this water, this well that we're having built right now.
And you're going into Accra, the capital?
Yes, yes.
Okay.
Yes.
So it's a school in...
The school is in Tema,
Oh, it's
which
in
is
Tema.
very
Yeah,
close
I know it.
to Accra.
It's very close. Right. Right. So this is going to be a first time for you.
First time for me visiting. We've had other members who have visited our school, but this is the first time as a group, as a chapter, we're visiting.
Well, we have a very, very strong and very important West African population in the DMV. And so this is exciting that you're,
It is.
going to be going and giving them hope,
Yes.
giving them resources and teaching them. I mean, how many are in your group?
There are 54 women in
There you
our
go.
chapter,
Okay,
but there are going to be 30
30.
30
really? It's a
people
big,
going over for this trip.
This is So this, being a member, though, of this organization that has really changed your life.
It has. It really has. It's enriched it greatly. I love the service. I love the outcomes that we're seeing. I love the populations in need that we reach. So, and the friendship. The friendship is just wonderful.
Right.
Women who are friendly to each other, who really love each other. You know, that's what it's
really?
all about.
It's all about, but the impact you've had on this community here in Montgomery County is tremendous.
Yes, we have a sister chapter in Montgomery County. We're not the only chapter in Montgomery County. There's a Silver Spring chapter.
Oh, there is, okay.
And we partner and do collaboration on projects with them also. So yes, we feel really good about the work we're doing in Montgomery County.
Oh, yeah. Going back, though, to your work as a healthcare, in the healthcare space, what has that revealed to you in terms of the progress we have made in terms of women's health? Because as you know, we didn't even have an Office of Women's Health for many years.
So for a long time, and it still exists, the disparities in women's health. A lot of times women are not taken seriously when they come to healthcare providers and talk about what's going on. A lot of times their problems are dismissed, as well as the women themselves that are so busy taking care of the family. We're caregivers. And so a lot of women, they think about their own self-care last. They're always trying to help the family instead of themselves. So it's been quite a bit of lack of education, lack of help, motivation for women to really take care of their health. And we're trying to really change that. We're trying to really address those needs.
Oh, this is great. And within the minority women's health community, you have issues like uterine fibroids, which are prevalent, as we know.
Yes.
And we don't. Do we get the attention? Are we getting the research? Are we getting?
So maternal health
Maternal health is huge.
is huge,
yes.
and it's something we try to speak to and address and educate. That will be part of the health fairs
Right.
that we do too, bringing in experts to talk about that, decreasing the infant mortality
Yes.
rates.
It's huge.
Is huge.
Yes.
And again, if you don't seek help, then nothing changes.
Right.
So we're trying to educate. We're trying to provide the care and education and access to the care that our communities need.
Are you right now, as as obviously a specialist and trained and worked in this field for 40 some years? I'm sure you're mentoring young women now today that want to get into your practice because it's such a laudable one, and
So I was a preceptor when I was working. I mentored young women in the field of pharmacy, and I precepted residents and students. So it was dear to my heart to bring more women into the field because, again, when I started, there weren't very many of us in the field. So it's really important that we let women know that they also can be in healthcare and that pharmacy is a great field for women. It's really a great profession.
is it, why?
It's been very rewarding, not only helping people, but seeing the outcomes. And so if you're interested in healthcare and helping people,
Right.
it's a great profession.
Wonderful. Well, this has been very enlightening for me, and I know for our viewers. And I thank you for taking the time and being here and talk about the exciting new Wellness Summit that you do not only in the month of March, but you do throughout the year.
Well, thank you so
Yeah.
much for helping me, having me. Appreciate the opportunity to share.
Oh, you are so welcome. You've been watching The Next Word. Please email info@mmctv.org if you have comments or special guests, and we'll see you the next time.